One of my colleagues that I used to know as a registrar, he's originally from Nepal, and he essentially raised some money, got a charity together. And what he wanted to do was he wanted to set up a hospital that could provide trauma care and also kind of local treatments for patients who couldn't afford any kind of operations or any treatment for themselves. We landed in Kathmandu. It's a good 4-hour drive on hilly roads, mountainous roads, through all the mountains in Kathmandu to Janakpur, which was the place that we did the surgery. And essentially what we did, we spent a whole week there, and we went out with the local doctors and surgeons that had been trained mainly in India, and we went out and we did mouth cancer screening camps. And what we did was we screened patients for free in rural villages around the surrounding kind of locale. The commonest things we saw were like neck lumps, were mouth cancers. I think mouth cancers was the major problem, so lip cancers, tongue cancers, neck lumps and salivary gland tumours was the common things. And the operations themselves, I try not to do the operations myself. I wanted the local surgeons to do it, and I was there kind of as a training capacity. The anaesthetists had to buy the drugs on the day, so we had to send someone out in a motorcycle to buy the medications that we needed to anaesthetise patients, and then they had to come in the morning, so we had to wait for that. The instruments that we had to adapt because they were all used instruments, sterile but used, so you didn't have all the little things that you were used to in the UK. The hospital is literally, it's just a few rooms. The nursing staff are very, very few of them. And so it was the post-operative care was again something to behold. It's quite an eye-opening experience, to be honest. It's a beautiful country, and the people are very friendly, and they were very hospitable, and it was quite heartwarming seeing some of the thank yous you got. As an experience, I think it's fantastic. But I think with these countries, I think it's important to be able to provide a skill set. So as a senior trainee, maybe I think it would be recommended because it gives them experience, contacts, and also makes them appreciate some of the skill sets that you need in different countries. It's got to be cost neutral for the charity hospital because there's a lot of money that gets it's charitable donations really. So when I went over there, I had to pay for my flights, pay for my hotels, and I also did, my time as well. But that's part of trying to help people, and that was part of my the charity work that I did. But I would. I think if you have, if you know people, if you have consultants who are going, I think it's always an experience to go because then hopefully you can take that forward, and go yourself when you're a consultant.